All right, Mr. B. As you know, I'll be observing your classroom this week. From your lesson plan and our conversations, I understand you want to identify what motivates your students. Can you tell me a little bit about how you plan to do that?
Well, with the lesson plan for this week, we'll be following the ACAP rule, which my students are already aware of. And with that being said, I will be able to do a formative as well as a summative assessments throughout the course of the week with my students. My goal is to use a universal approach with my students. And some teachers would say you're watering the lesson or you're dumbing it down, but I like to believe that I'm educating the students up, and that's to take my time and to make sure that all the students are caught in the process. And when what we're looking at is looking at our social skills, and we're also looking at counting and working with numbers this week.
Okay, great. Knowing that you have that dual diagnosis in your classroom, with your achievement measures, how do you plan to differentiate the assessments to meet the individual needs of your of your students?
Okay. Well, because of the issues and trying to look at the diagnosis and things of that nature, I know that those particular students will have staff members that will come in and help me with those students. And as the issues may escalate or the situation may escalate, then I can have them escorted from the room. But however, I will have them brought back to the room, and then that way I can look at the behaviors and things of that nature and seeing if it's me, the lesson, or if it's actual the behavior. And then once I've been able to trigger or find that what the trigger is, then I can be able to assess myself as well as
Okay.
assess the situation, and then
Is there anything that you would like me to look for as the observer? Maybe the number of hands raised, the interaction level, anything in particular that you would like me to look for as it pertains to your observation?
Yes, look at for me, I guess maybe tally the students that are actually participating in the
Okay.
classroom. And then what I'll be, once again, with the assessment as they make their exit, then I can use the check and the minuses or the checks and the slash marks to let me know which students that did or did not participate.
Okay.
And then you can look at the level in which they're raising their hands. If they're verbal because of issues and situations I also have to address. And if you would also, which is a key factor, is that if the students are just kind of acting as a recluse, sitting away from the crowd, don't want to be social, things like that. And
B.
good morning, sir.
And this is our post observation conference. I really enjoyed observing your class the other day. Your students seem to be very interactive. They seem to enjoy themselves while learning. Grouping them together seemed to really increase their interactions and their excitement. Can you reflect a little bit about what do you think the successes of your lesson were?
Well, I realized that I had to break the students down in smaller groups because some of their educational level was not, meshing or working together. So those that their level of learning was a little less, I had to kind of make a differentiation in the groups, and that seemed to work much better.
The key out to document the achievements for your students on this particular lesson is I see here about a 6 out of 10 earned a check, while the others earned a slash. What do you feel contributed to the difficulties?
Well, I realized because at the residential treatment facility here, is that I think some of the issues were change of medication, because sometimes in the mornings the students were somewhat sluggish or irritable, and it was not because they didn't want to learn,
Mm-hmm.
but it was because of a change in medication and their bodies were adjusting. So um, the nursing staff, I was not informed of changes other than a visual, observation on my end. So that was one of the concerns that I had. And as in for the learning part of it, for my
If
students,
I understand correctly, it seems like there might be some sort of a communication barrier between the disciplines. So maybe we can take a look at improving the communication systems between the disciplines. How do you feel about that?
yeah, and I think, if you would kind of, give me some additional pointers, how I can get the nursing staff just to kind of notify me um, when they're going to change the medication, because I know every 30 days they have a treatment meeting or something of that type with the team. And during that time, I would like to make sure that they continue to keep me in the loop for those changes.
Okay. So maybe we could probably get like a weekly email going, maybe every Monday, or something to that effect. Kind of making sure that we get appropriate correspondence on the medications that they are taking, any changes that may have occurred over the weekend, any behavioral things that we need to be knowledgeable of for our piece, as far as the education piece is concerned, and maybe that could remediate some of the difficulties